We are thrilled to welcome you to our 2020 Connected Health Summit Consumer Engagement and Innovation virtual conference. For decades, we have been looking closely at consumers' use of technology in the home. More recently, connected health and medical devices have enabled new services for consumers to monitor their health care. This has come in all sorts of new form factors and with monitoring services. The global pandemic has also greatly accelerated the use of health services in consumers' homes. We have seen telehealth services skyrocket. 41% of consumers have reported using a telehealth service in the past 12 months, 3 times greater than the year prior. We are excited to bring you 3 days of discussions focused on consumer use of technology in their homes and the impact of the pandemic on new services. With the support of these industry leaders in the health and wellness space, we are able to host this event. Thank you to our sponsors for their involvement in our 7th annual Connected Health Summit. We have presentations from visionary speakers throughout our conversations and networking discussions following our panels moderated by Parks Associates analyst team. We want to thank these industry leaders in advance for their time. Tori Ames, Dr. Donna O'Shea, Mark Dunning, Jean Wang, Richard Culberson, Angie Kalausk-Ebrahimi, Dr. Yuri Quintana. Thank you for joining us for Connected Health Summit 2020. We hope you find value in each session and in connections made with other attendees, sponsors, and speakers. Use the question tab to ask your questions or to upvote your favorite questions from other attendees. You can also answer polling questions under polls to give your live vote. Our analysts and panel speakers will be addressing your questions and the polling answers during the live stream. Ask your questions early in the presentation as our analysts will choose the most upvoted questions to be addressed by the session speakers. If you have any questions during the stream about SwapCard, our team is standing by to help. Just drop a message in the chat or message one of Parks Associates team members via the Parks Associates company page. We want to make sure you're connecting with our industry-leading sponsors in the smart home space. You can visit any sponsor during the session by navigating to the Sponsors tab, browse sponsors, or bookmark the ones that interest you for later. Contact the sponsor via chat, view uploaded documents, watch welcome videos, and more. Have you created your personal event agenda on SwapCard? Go to the Agenda tab, view different sessions under each date, add the sessions that interest you to your personal event agenda. You can access your personal event agenda by clicking the My Event tab. Export your agenda to your calendar to receive reminders and a direct link to your registered sessions. Our latest research shows that between Q1 2019 and Q1 2020, intention to purchase a smartwatch rose from 13% of U.S. broadband households to 20%. Over the past several years, we've seen innovations in technology that have ignited the imaginations of many, with consumer wellness devices increasingly encroaching into the medical space by monitoring an increasing number of vital signs. The most notable additions to date include high and low heart rate notifications, EKG detection of abnormal heart rhythms, and blood pressure monitoring. With an ongoing pandemic situation, the ability to track these metrics and be notified in the case of abnormalities may be extremely valuable to many. Tech giants in the consumer space are also beginning to make inroads into the medical market. COVID-19 has accelerated many emerging solutions in the healthcare space, especially use and familiarity of telehealth services. We anticipate increased use of medical devices in the short and near term, ultimately leading towards long-term increased usage. As consumers integrate connected devices and services ever more deeply into their lifestyle, They bring the same expectation and desire to their health and well-being. We anticipate more changes to come in 2020 as consumers adapt to being at home more, consider new ways to exercise as a result of limited gym time, and pay closer attention to medical issues. Thank you for joining us to learn more.
Good morning and welcome back to day 2 of Connected Health Summit. I'm Jennifer Kent, Senior Director of Research at Parks Associates, and I'm so excited to be kicking off this morning's session for us. If this is the first day you're attending, welcome. I hope you are familiar with Parks Associates Research. We are a market research and consulting firm focused on the consumer technology markets. For the past 10 years, we have studied the connected health market, connected health solutions in the home, from telehealth services that connect the facility to the home, to remote patient monitoring solutions. We've studied consumer adoption of connected wellness, fitness, and wearables devices, as well as solutions that help seniors and their family caregivers age safely and well at home. We produce over 100 syndicated research reports each year and provide research and consulting services to over 500 companies annually. This is our 7th annual Connected Health Summit, but our first virtual one. So we miss seeing you all in person. I personally miss the wine and cheese afterwards. I miss that human connection. But I'm so grateful for the technology that makes it possible for us to connect in this new way, and for our sponsors. Truly, without our sponsor support, we could not have made this event work. So a huge thank you to Alarm.com, to Nortec, to Athena Health and Softec, to Beckler and Spratzy Network for helping us move these executive events, move Connected Health Summit to a virtual format. On day 1, we focused on the big picture of how COVID-19 has disrupted all stakeholders across the healthcare ecosystem. Its impact is being felt by providers, health systems, payers, vendors, and of course, consumers. We talked about the rise of telehealth and remote patient monitoring as traditional avenues for care became inaccessible during this time. We talked about reimbursement and regulatory changes that have made this possible, and the hope among many that these changes, the regulatory and reimbursement changes, will be made permanent. We heard visionary insight talks from Tori Ames with Cincinnati Children's Telehealth Center, and Dr. Donna O'Shea with United Healthcare, as well as perspectives from companies including Omron, A&D Medical, TytoCare. We heard from Optum and Sirona Strategies. We heard from MD Live, Livongo, and Athena Health. And personally, I really enjoyed connecting with so many of you in our Zoom networking discussions following the morning and afternoon sessions. It felt a little more like we were all back in person together. So great to see your faces and catch up with you. Today, we shift our focus to the home and the consumer perspective. We'll focus this morning on the impact of COVID-19 on seniors, on their family caregivers, and on the independent living market generally. I'll kick things off this morning with some research from Parks Associates from our recent survey of seniors and family caregivers about their experiences during the COVID-19 crisis, their concerns, their needs, and their interest in and use of connected health tools and services. We'll then have a visionary insight talk on telehome care in the COVID-19 era from the Care Planning Institute and People Power. These are 2 companies that are working together to serve seniors in their homes, so that should be really interesting to hear their dual visionary insight talk. And then we'll follow up with a panel discussion with 4 great speakers from 4 industry leaders, speakers from Papa Technologies, from Best Buy Health, from Grand Care Systems, and from Independa, to hear how their companies are adapting to the changes in the market. And in the afternoon, our focus shifts to the opportunities for partnering with companies serving the home in various ways, from service providers like Cox and Comcast to those in the security and access control space, like Alarm.com, Alarm.com and Asa Abloy, as well as the independent living space like Essence. So please be sure to join us this afternoon as well. Now, if you joined us yesterday, you've been primed on this, but if you're newly coming in today, I want to make a quick note on how to engage with our speakers. You should see a panel on the right-hand side of the Swap Card platform with 3 tabs: a chat tab, a questions tab, and a polling tab. In the questions tab, if you have a question that you want to ask the speakers, please put those in the questions tab. That's where our team will be looking for those questions. And you can even upvote questions that you like that others have submitted. So it's a great way to engage with Park Associates analysts, with our speakers, and we'll take those questions throughout the day. In the polling tab, we'll have some polls that we're asking for you to answer, so we get your insight, your input. So please check out those polling questions. You can take them at any time. The ones that are served up there right now, I'll be taking a look at the results a little bit later in this morning's session during our panel discussion. And finally, there's the chat tab. So that's a little more unstructured, a little more free form. Feel free to leave some thoughts that you have in there. There also may be some notes from our team. And following both the morning and the afternoon discussion, we will do breakout networking discussions again, which are essentially Zoom chat rooms where we can come together and connect and continue the conversation. It's a little bit difficult sometimes to find that networking discussion link in the platform. So when it's time, our team will be posting the links to the networking discussions right in that chat tab. So please look there for them. Okay, with that, let's dive in. So I'm going to start with Parks research here and what our research has to tell us to help us understand the senior and caregiver mindset right now. First and foremost, we have to recognize that seniors are a unique group and have been impacted uniquely by this pandemic. They are at higher risk of poor outcomes, hospitalization, and death if they contract COVID-19 compared with younger populations. The CDC has reported that 8 of 10 COVID-19 deaths in the United States have been among those ages 65 and older. Of course, grouping all people ages 65 and older together as one group hides an incredible amount of diversity in lifestyle, in health status, in their needs and their concerns. So looking at the CDC data with even more granularity, you can see that, again, seniors are at higher risk of hospitalization if they contract COVID-19 than younger consumers, but that risk rises dramatically for those ages 75 and 84, and then even higher for those ages 85 and above. And of course, age is not the only risk factor. Underlying chronic conditions, obesity, asthma have all been shown by the research that's been made available so far to drastically increase the risk of poor outcomes with COVID-19. But we also know that seniors have much higher rates of having one or several morbidities, again, emphasizing that high and special concern for this population. That risk of infection has had a ripple effect on the impacts that we're seeing for our senior community. The risk of infection has been particularly high for those living in senior living facilities, with outbreaks reported in many communities. We've seen stricter guidelines come down from policymakers at the national and state level, both restricting visiting, visitation from family members, and instituting new policies for senior living facilities, as well as stricter guidance for those living in their own homes related to the need to social distance. And during some phases of this pandemic, to shelter in place and to really stay home. These measures meant to physically protect our most vulnerable populations may exacerbate feelings of isolation and loneliness, which is already a known concern for many seniors. But of course, the burden is borne not only by seniors, but also by their caregivers, family members who may have been caring for or interacting with elderly parents, for instance, near daily, now trying to figure out how to care for their loved ones without risking exposure. All of this leads certainly to new need for services or solutions that can help, but also perhaps a new awareness among consumers about what may already be out there to help, and a new searching for information for solutions. Maybe a new openness to connected products as potentially part of the solution. So let's look at what the consumers themselves have told us about their experiences during this time. This data comes from a survey fielded in May 2020. For some context, during survey fielding, during that time, the US had surpassed 1.5 million total cases and 100,000 COVID-related deaths. Nearly 40 million Americans were unemployed. Though at the same time, the cases in New York were declining, and many states had begun the early phases of reopening from the initial shutdown, just to give you some context about where the respondents were mentally as they were answering these questions. So seniors during this time were much more likely than younger consumers to be taking stricter distancing measures. 62% of those ages 75 and older, for instance, were sheltering in place, that is staying at home, in May versus just 37% of those under age 65 during that time, who may have been taking less strict measures like going out but social distancing, not going to places where there's large gatherings of people, taking precautions while they go out, but not necessarily staying at home. So clearly seniors are taking precautions to protect their health and that of other house members as well. We've seen organizations really respond to the need to keep seniors safe. So beyond the recommendations I just mentioned from the CDC and special precautions from senior living facilities, we've also seen retailers like Target and Walmart and pharmacies like Walgreens, as well as many local grocery stores implementing senior hours to allow seniors and other at-risk populations shop with fewer shoppers in the store and at a time when the store has been recently cleaned to again help serve those who may be at most risk. So in response to the pandemic, state policy leaders, as well as health system and practice leadership, limited in-person delivery of non-essential care services. We talked about this a lot yesterday. While most seniors were still able to receive medication refills, 15% of seniors report having to cancel or reschedule a previously scheduled medical procedure. And 34% were unable to visit the doctor for an in-person consultation or checkup. As we saw across the board, we talked about this yesterday, this has driven an enormous use of virtual consultation by necessity. And that goes for older consumers as well. 29% of seniors report using a telehealth service as of May 2020. And while that is significantly lower than younger consumers, as you can see here, those under age 65, 44% of those under age 65 use a telehealth service versus 29% of seniors. It's still a 5x increase year over year. So in 2019, just 6% of seniors reported using a telehealth service across all modalities, phone, chat, text, video, and that's increased to 29% this year. Now, interestingly, seniors report relatively positive experiences with telehealth. In fact, they are much more likely than younger consumers to report that the issue for which they sought care from a provider during the telehealth visit was fully addressed during that visit. Younger consumers needed some additional follow-up care. 45% of seniors reported that their telehealth visit fully addressed the issue versus just 31% of those under age 65. That may also speak to the types of issues that they're seeking care for, of course. Seniors are also much more likely to rate several aspects of the telehealth service very good or excellent. For instance, 70% of seniors who had used telehealth were satisfied with their insurance provider's coverage, for many that would include Medicare, compared with 55% of younger telehealth users. 69% of seniors rate the quality of doctors they spoke with as very good or excellent, compared with 56% of younger telehealth users. And 63% of seniors felt the time it took to speak to a provider was very good or excellent, compared with 56% of younger consumers. What's also interesting here is that seniors and younger consumers are even in their rating of ease of use. This is honestly quite extraordinary to me. Younger consumers are simply, when we look at use of technology across the board, not just in the health space, younger consumers are simply much more likely to be tech savvy. They're more likely also to be repeat telehealth users, to have tried this in the past, and this is something they've done before. They are less likely to need technical support when we think of technology use generally. So the fact that the majority of seniors are rating these services as easy to use is pretty incredible. I think part of the story here may be one of low expectations. In research prior to 2020, older consumers had very, very strong preferences towards in-person care, which isn't uncommon for all age groups, but it was particularly strong sentiment among older consumers who were highly skeptical that telehealth services could provide that quality of service. So when forced out of necessity to try it, virtual services and the care providers providing care across virtual services, using them, are actually exceeding seniors' expectations, which is a great sign. Now, family caregivers we know are incredibly important in the care of aging loved ones, whether they be spouses, adult children, or other trusted people in their social network. Not surprisingly, the impact of the COVID-19 crisis on the loved ones for whom they care is the number one concern of caregivers right now, followed by a few categories that are perennially at the top of caregiver worries. Year after year, ongoing health issues, accidents and emergencies, disabilities, mobility issues and declining strength, and finally, declining cognitive capability or memory issues top the list of caregiver concerns. Interestingly, there's a pretty big gap between concern about cognitive and memory issues and concern about the loved one wandering from home. When we ask caregivers about the health conditions their loved one is struggling with, dementia is one of the most common conditions after cardiac issues and diabetes. The CDC expects the US population with Alzheimer's and related dementias to grow from 5 million people in 2014 to nearly 14 million people in 2060. So we know if you're in this space, this is a major a problem that impacts many, many people. But that said, people can be very much on a spectrum of progression or, of course, undiagnosed. And so the need for location monitoring will not apply to everyone at a particular time. However, when the need becomes evident, it is a very high concern and an immediate need to solve. So add-on devices and services that can help here as people progress is one solution to consider. We tested the appeal of 4 form factors of smart products that can help seniors live well and independently. A traditional PERS style device, so that PERS stands for Personal Emergency Response System, right? A panic button, traditional panic button type service. With fall detection capability, we tested here. We also tested a smartwatch that detects falls, has a panic button, but also detects location and some vital signs. A home sensor-based system with passive monitoring where no devices needed to be worn, and then a smart speaker or smart display type system. About half of caregivers find each solution appealing. Interestingly, the smartwatch, which is essentially a PERS device plus additional capabilities here, so it's actually a fuller featured option, scores lower than the basic PERS devices. This may relate to expectations about the pricing differences between these two. In this particular survey, we don't have pricing attached to it. So, there's of course going to be an expectation that a fuller feature service may be more expensive. Also, it also speaks to consumer familiarity with the basic PERS solution. Of the solutions tested, a panic button is a known solution to a clear problem. Though the fact is many PERS providers are no longer staying in this lane or in this bucket. Companies like Essence and Nortec, Numera, Mobile Help, and others have expanded beyond the basic PERS offering, incorporating some, if not all, of these other form factors into their solutions. So a smartwatch look to improve aesthetics and the acceptability that the wearer, feels okay or even, proud to wear one, as opposed to it signifying, illness or weakness. Step counting for more positive focus on proactive wellness. Passive sensors for activity monitoring or fall detection and voice control. as another way to call for help if able. We're seeing a lot of innovation in the independent living space, and we'll be talking about how this space is moving and changing with our industry insight speakers in just a little bit. One important element of serving seniors well is to understand that the senior and caregiver attitudes often diverge. They have distinct concerns and are looking for different assurances from a potential solution. So both seniors and caregivers rate safety-related features among their must-have features of an independent living solution, but seniors place even greater weight on those safety features, while caregivers are much more likely to see the value in health monitoring. So for instance here, 28% of caregivers list medication reminders as a must-have feature of an independent living solution versus just 22% of seniors. 21% of caregivers rate step tracking and other wellness indicators as must-have features versus just 12% of seniors. And one other feature to note here, where there is consistent divergence, is the use of monitoring cameras in the home. So seniors are adamantly against monitoring cameras in the home. It's just one step too far, crossing a personal boundary of privacy and really of dignity. Many caregivers would really value that footage, value that peace of mind, to be able to look in on their loved one and see that he or she is okay. But it's just one step too far for seniors themselves. Now, external cameras are entirely different. They provide peace of mind against home break-ins, or a convenient way to see who is at the door, especially if you've got mobility issues and it's difficult to get up and get to the door, right? The ability to see that footage on your TV or smartphone or tablet from where you are in the house is certainly a high convenience factor. It's a completely different value proposition, and one that aligns much better with seniors' overriding concerns about safety and peace of mind over health monitoring. Of course, important barriers remain. The top 3 reasons that caregivers here do not purchase independent living services or are not interested in the solutions we tested are cost concerns, cost expectations of cost being too high, usage concerns, and privacy concerns. These are all concerns that top the list in 2019 as well. Pricing was not mentioned in the study, meaning caregivers have a perception of solution pricing being out of their or their loved one's budget. And with many seniors living, of course, on a fixed budget, obviously you can see where the concern is there. That said, there is some government subsidization for certain solutions, and compared with the cost of in-home skilled nursing care or a move to a senior living facility, all independent living solutions are vastly more cost efficient. The issue of the value equation, which is really, what that is, and the second and third barriers, anticipated usability issues and anticipated privacy concerns, are all matters of consumer education at heart. They're not necessarily structural or fixed barriers, but issues that require connection with potential users at the right time in their research journey. Caregivers are concerned, will their loved one agree to use the system? And if so, will they be able to operate it? These types of questions require some pretty delicate conversations between family members, and we have seen leading companies in this space tackle that issue head on. Some we've seen actually provide on their websites coaching strategies for caregivers and their family loved ones for having these types of conversations. Of course, those in this space know also that this is a very reactive market. Most senior assistive technology purchases occur following an acute care episode. Few proactively buy these solutions, which is why, on the one hand, adding in ongoing chronic care monitoring or wellness and fitness features is such a popular strategy as an attempt to move from reactive to proactive purchasing. But this established behavior of reactive buying, let's say after a fall occurs or a major medical issue occurs, does speak to the incredibly impactful role that professional care providers can play in providing information or solutions or recommending solutions, or even becoming a distribution channel for solutions that support seniors living at home. Finally, I want to encourage us to think broadly today. So, the COVID-19 crisis has forced older consumers to change up their established habits, just like the rest of us, right? To embrace new ways of doing things. Increased use of telehealth is just one example. Older consumers are also trying new communication tools to stay connected with loved ones. So during the COVID-19 crisis, 29% of seniors report having used a video conferencing service. And for the majority of them, it was their first time doing so. 1 in 5 seniors have used a grocery store delivery or pickup service. And for 2/3 of them, it was their first time doing so. And then 17% of seniors have used a retail store delivery or pickup service. And it's the first time doing so for 42% of seniors that had used this service. So I think there is a moment here where people are oftentimes out of necessity trying new things, maybe a new openness among older consumers right now to try new things, and an opportunity for those in the industry to consider new and better ways to reach and serve seniors. So throughout this morning, there are a couple themes that we're going to talk about with our industry speakers. We want to understand from them, they are working with seniors as their customers and family caregivers. From their perspective, how have senior and caregivers needs changed? What impact has COVID-19 had on demand for their solutions for senior assistive technologies and services? How have these industry players adapted to new market realities right now? What changes are they making to their products and their services to better serve their customers? And also talking a little bit about solving usability. So one is about designing for seniors well, and then also reaching seniors, especially those who may have unreliable connectivity or no connectivity at home. So we're about to go to our industry insight speaker, our visionary insight speakers. But first, I do see that there were a few questions that came in here. One was about the survey data points related to these slides. So I do know that the slides that I just presented are going to be available in this platform if they're not already. Our team will give you instructions on how to access these slides. The full data behind the study is being published in our report on the COVID-19 impact on seniors, caregivers, and independent living market, and should be out in the next week or so. So please reach out to us if you're interested in the full data behind the study, and we'd be happy to walk you through the whole study and what's available and how to access that. Another question is, do you know who is making the purchase of the product? Is it typically the elder person or the caregiver who's purchasing the product? It's both and. Even if the caregiver is not the actual purchaser of the solution, which is sometimes the case, they're often very much an influencer, which is why we always focus on them as a very important part of this narrative and story that the ability to pay or who's going to pay often is part of that maybe awkward personal conversation that happens. Sometimes the senior insists on paying, and again, it's a matter of maybe control of what's going on in their own home, as well as that dignity of I can pay for my own solutions and services. Other times, it's the younger or the family caregivers that's doing so. But oftentimes those family caregivers are absolutely in on the conversation. We've seen that from not only survey data, but also in focus groups that we've conducted over the years with family caregivers and seniors. And are there any other questions to the team here that came up? I don't think so. So thanks for the great questions. Looks like you guys have figured out the questions tab, which is wonderful. Keep them coming for our industry insight speakers who are next up. So with that, let's go ahead and bring them in. We'll be hearing from Mark Dunning, who's the president and CEO of the Care Planning Institute, as well as Jean Wang with People Power. And give us just a moment. We're going to transition and bring them into the conversation. We'll be back in just a minute. Okay, great. So we're back. So again, let me introduce Mark Dunning, the President and CEO of Care Planning Institute. Mark, how are you this morning?
Great. How are you doing?
Great. Thank you so much for joining us on our second day here of Connected Health Summit. Please tell us a little bit about Care Planning Institute, and feel free to launch into your slides and what it is that you have to tell us about your experience with telehome care in the COVID-19 era.
Yeah. Can you guys see my screen okay right now? Are you guys able to see my screen right now? Okay. Hopefully you are. Just a little bit about me. I'm located here in sunny Southern California, in Irvine, in Orange County, which is smack in between of Los Angeles and San Diego. So we're about 78 degrees today. Not much changes here weather-wise. But anyway, just a little bit of background on myself. As you can see from my bio, I studied public health at BYU in Utah, and then got a master's degree in public administration from the business school there with an information technology emphasis. Started out working in PricewaterhouseCoopers healthcare consulting practice. And then in 2007, my wife, Christy, and I launched our very own non-medical home care business here in Orange County. And 3 years after growing that business to a large organization, we launched AHI Group. And that has now grown into 455 home care agencies nationwide, providing non-medical aid care services to seniors. In 2013, we launched Care Planning Institute to help aging families, families with aging family members, find solutions for care and also funding to pay for those services. And in 2015, one of our member agencies in AHI Group launched a software company with us, and we recently partnered with People Power on that software company, and Jean will be speaking to you a little bit about that partnership and some of the other things we're doing technology-wise. But today I'm going to focus on our mission here at Care Planning Institute, which is to help seniors identify what care options are out there and find funding to pay for those care options. A typical scenario that you may have encountered personally in your own lives, a very typical scenario that we hear on the phones regularly here at Care Planning Institute, is dad falls, taking out the trash down his driveway, ends up in the ER. He's cut and bruised, but no broken bones. The doctor recommends assisted living or some type of aid care at home to help him stay healthy at home. The old, an ounce of prevention is worth a pound of cure, obviously, is as the old saying goes. Then, of course, children start researching and looking out there for different options, and find out that in-home aid care costs $27 an hour, and typically Medicare is not going to pay for that, or assisted living on average could cost around $4,500 per month. And then the family's heads are spinning. What do we do now? Who do we talk to? Are there other available care choices? Is technology available to help us take care of dad in his home? Are there funds available to help pay for dad's care? Does Medicaid pay for long-term care? If so, how much does it pay, and how does dad qualify with his income and assets? Are there other state and federal programs out there to get funding for dad's care? And does dad have a long-term care insurance policy to cover some of these expenses? Typical result, many families don't know where to turn in these situations. Social workers at hospitals are often overworked and have little time to spend individually with families and help them through all the details that they need to get through in order to make informed decisions. Many seniors cannot afford or just don't want to spend $27 an hour on an aide to come into their home. And so ultimately what happens is seniors remain vulnerable in their homes until the next incident happens, right? If family can't step in and help out and be the family caregiver or whatever, then the senior remains at their home and is vulnerable now till the next situation happens. And also health plans, of course, spend vast amounts of money today on procedures and care for these individuals that could often be avoided, some of these costs, if appropriate care was in place in the patient's home to help them stay healthy and safe at home and not have that ER visit and reduced ability health-wise ongoing. Solution then Care Planning Institute steps in to help families navigate through their care choices and find funding to pay for those care choices. We work with clients nationwide through phone and email to help them identify various state programs out there, Medicaid, PACE. These are a couple of the main programs out there that can pay for long-term care solutions, like aid care and telehealth devices and those types of things. A popular funding option that I'm going to focus a little bit on today is through the Veterans Administration, named the Aid and Attendance Pension Benefit. I'm going to jump into that here. But the end result is improved quality of life and less chance of circling back to the ER. And that's really our goal here at Care Planning Institute. Aid and Attendance Pension Benefit, some of you may have heard of this before. For those of you who haven't, it's for elderly veterans over age 65, their living spouses and surviving spouses. They can qualify for up to $2,264 a month to pay for aid care services and certain telehealth devices to help them stay independent and well at home. Studies from the VA show that about 15 million seniors could qualify potentially for this benefit, and only 3% of them have it today. The reason for that is that most don't even know this money exists out there, unfortunately. So there's a bit of an education gap out there. Some know it exists and have gone down to veteran service offices to apply and found that it's almost like I kind of compare them to going to the DMV. You take a ticket to wait in line 3 hours, to wait in line for another 3 hours to take another ticket, and you get 3 of your 10 questions answered, and hopefully they were answered correctly, right? So these are just some of the challenges that these veterans and their spouses encounter. Some basic requirements to qualify are you have to be over 65 years old, need assistance with ADLs, military service, meet certain income and asset requirements. One of the main income requirements is that you have to have zero income to qualify for this benefit. Most people say, well, how can you have zero income? If you have Social Security, you obviously have income. Well, one of the things that most people are not told is if they are spending money on certain care expenses, aid care, telehealth devices, and different things like that, that actually discounts their income. So if I have a veteran who's got $1,900 in Social Security coming in, and they're spending $1,900 on care services and telehealth devices, their income now becomes zero in the eyes of the VA. So it's like a reimbursement benefit. You spend money on care services and you get reimbursed for those care services. The VA requires these care expenses actually be in place when the application is filed with the VA. And once you're approved, you then get retroactively paid back for the care expenses that you've had thus far since your application went to the VA. This does require that you spend money out of pocket, of course, up front and wait to get approved. Most people who go to the VA directly could wait 1 to 10 years to get approved due to the red tape and everything involved with that. We have accredited agents on our team who get these applications done directly with the decision makers at the VA, and we get them approved in about 2.5 months on average. But still, people have to spend money on care to bring their income to zero during that 2.5 month period. So instead of making them do that out of pocket and wait to get reimbursed, we actually provide an interest-free, no-fees loan to them so that they can start the care, get the care in place, get their telehealth in place, whatever they need, and get their income down to zero so they will qualify for the benefit. Once they're approved, the VA pays them directly to their bank account, and then they can pay back their interest-free care loan. So basically, it's just a turnkey solution to help these vets and their spouses out there get this benefit. It's one thing also to get the benefit and get approved for the full benefit and not wait years like many people do to get it. It's another thing to stay compliant. We've had individuals come to us over the years with a letter from the VA saying they owe $75,000 in back pay for their VA benefit because they fell out of compliance unbeknownst to them 3 years ago, and now the VA wants all the money back from the last 3 years of benefit in an overpayment. So we obviously make sure that we are tracking these applications ongoing, reporting hours to the VA, and making sure they stay compliant so that these veterans and their spouses don't have to worry about ever getting an overpayment letter in the mail and having other government payments and benefits garnished to pay that. So, end result, elderly veterans, their spouses get the care services and telehealth devices they need to help them stay healthy at home, paid for by the VA. The veterans never have to leave their home. We work with them remotely. They don't even have to go to their doctor's office to get their medical exam done. We work remotely with doctor's offices to do that. And they get the help they need to stay well at home. Health plans also spend less money on these patients because they stay healthy and well at home and don't end up having those have the level of frequency of ER visits and those types of things that lead to additional cost and everything. So that's everything that I wanted to present today. Jean is now going to jump into talking a little bit more about technology and some of the things that we're doing technology-wise to help seniors stay at home with affordable options. I wanted to open it up and see if there are any questions. I know that was a lot of information in a very short period of time. So.
Yeah, thank you so much, Mark. I think what we'll do is there are questions that I think are coming in, but we might take questions all together at the end. One question you can address actually right now before we bring Jean in would be, from your perspective of working with seniors and especially veterans, what are the leading reasons that seniors are unable to stay living independently and that they seek extra medical care, from your experience?
It did cut out a little bit. There was the question, what are the main reasons that seniors want to stay independent? Is that what you said?
Main reasons they're unable to.
Oh, unable to. We find that funding often is one of the main reasons they are unable to stay in their chosen place of residence independently. And, going to assisted living or staying at home, there's a cost to that. Right. And unfortunately, long term, Medicare is not paying for that. Obviously, Medicare Advantage has come out and said we're going to start paying a little bit here and there. But most of those plans are 150 hours a year. So that's 3 hours a week. 3 hours a week of care isn't a lot of care. Unfortunately, a lot of people need more than 3 hours a week. Right. So right now, those plans really aren't covering what most seniors need at home. Mm-hmm. That's what we like about some of these other programs with Medicaid or PACE. If they qualify, and they can get typically on average about 16 to 20 hours of care a week through those PACE and Medicaid programs. But of course, they have to qualify for Medicaid, and only about 10% of seniors out there will qualify for Medicaid. That's what we like about the veterans pension benefit, is that the requirements to qualify financially are so much easier. And in fact, about 73%, according to AARP, of seniors will qualify for the VA benefit, with their asset and income requirements for that benefit. So it's just a lot easier to get them extra couple $1,000s a month, which could pay for 15 to 20 hours of care, and that could be the difference between them staying independent at home and then ending up in a Medicaid paid nursing home, right, and not being able to stay at home.
Okay, well, thanks so much for taking that initial question. I will bring you back in here after we hear from Jean. So hang on for us. Jean, let me bring you in. This is Jean Wong, the CEO of People Power. And Jean, I know it was Wong and I mispronounced your name earlier, and I'm so sorry.
Jennifer, that was a great presentation that you gave, and really tracks my presentation very well. And Mark, I think you really spoke about one of the most important things, which is how are people going to afford to pay for these solutions to keep them safe in the era of COVID-19. So thank you both for that.
Yeah, please tell us, go ahead and tell us about People Power and take us through your presentation, and then I'll come back in and we can do some question and answers afterwards.
All right. And can you see my slides?
Yes, there they are. Okay.
Excellent. So really happy to be speaking again at another great Parks Associates event. And I'm Gene Wong from People Power. And really, the era of COVID-19 has transformed healthcare. The time for telehome care is now. One of the reasons is because more than 40% of the COVID-19 deaths are linked to nursing homes. And I think it's like 40 to 50%. So people and caregivers are very concerned, as Jennifer was talking about. And even before COVID-19, living and aging comfortably at home was a basic desire for like 90% of the people. So COVID-19 has really magnified and accelerated this need. So what we've been working on hard for several years now at People Power is to build a system that handles multiple problems with multiple safety nets. As Jennifer laid out, the PERS systems are still quite popular because people have heard of them. But on the other hand, they don't work if you don't wear them. And we've heard that, half the time, somebody who's paying for a PERS system needs them, they're not wearing them. So that, of course, makes it difficult to use. So what we try to do at People Power is support a whole network of systems, from a home activity sensor network, which requires the senior to do nothing. It also does not include a camera because of privacy concerns. It also consists of what we call a personal assist button, essentially a PERS panic or emergency button, as well as the popular smartwatches. For example, we support the Samsung Galaxy as well as the Apple Watch. So this gives you emergency support anywhere you are, and it looks glamorous, elegant, and people want to wear them. Really, the heart of our system, though, is the unique bot machine learning framework, which gives peace of mind by helping to watch over the seniors 24/7 and does things like fall alerts when something may have gone wrong. Falls are one of the leading causes of death by injury for people over 65. Wandering alerts, and particularly with people with diseases such as Alzheimer's or dementia, they may wander out of the house and get lost and not be able to find their way home. So alerts for wandering, for sleep monitoring, making sure people are getting enough sleep. My mother, who's 84, I was just talking to her this morning. She's really having problems sleeping, and she needs to get more sleeping medication. And I'm going to go over to Kaiser and pick some up for her today. And medication adherence as well. So there are 55 million Americans over 65 where falls are a major cause of death, and yet major gaps exist in today's old-fashioned, old-school PERS button solutions. This is a large and growing industry. It's still $3.6 billion per year. And we're really trying to close the gap with these bots, as well as communicate to a trusted circle of family, friends, professional caregivers, such as AHI has, as Mark was saying, has accumulated 455 caregiver agencies. And this is really a great resource for families who can afford it. And if you combine technology such as ours with people such as home care agencies, that can be the winning combination to, at a lower cost, provide a total solution that solves major problems like falls and wandering, but also brings people together to reduce the loneliness and stress which lead to depression in this era of COVID-19. We have actually had a tremendous amount of progress and early success in this landmark research project that we have been working on with the NIH funding, along with UC Berkeley. And we are showing in our preliminary results that we can reduce the anxiety and depression and improve the caregiver well-being through these efficacy and effectiveness trials that we're running. And here you can see 3 graphs where the control group has a solution with only the water leak sensing device active. And the active group in orange has the full solution. And you can see that we reduce anxiety, we reduce depression, and we increase emotional well-being. So this is really a landmark study that we are very fortunate to be working with UC Berkeley on, and really leading to some great results. Of course, just knowing what's going on is not helpful unless you can tell people about it. So we have a very sophisticated system with intelligent alerts that move from contacting the people who live in the house, as well as associated healthcare professionals who may be assigned to this home. Really building and communicating via texting as well as in-app notifications. Texting is important so that nobody has to actually install an app. Of course, we do have apps, but Trusted Circle can jump in, and then backed up by an emergency call center with 24/7 emergency response that can dispatch an ambulance or other services in the worst case. But every day, we also produce via our bots a daily report of activities, of meals, medication, bathroom usage, as well as social reminders to connect with your senior loved ones. And if a Trusted Circle contains 7 people in it, for example, then 1 person a day is reminded to just do an old-fashioned phone call or share a picture and that type of thing. So it spreads the responsibility of communicating amongst a Trusted Circle. But in this one, 11 people are in this Trusted Circle. So less than once a week does 1 person have to communicate. We connect with hundreds of different types of devices, not only the Apple Watch and the Samsung Watch, but even the Livio hearing aid, bed sensors, temperature sensors, voice controllers, water leak, and so on. So we connect. We are really a smart home services company focusing on care and really making it safe via telehome care for aging safely in place in this pandemic era. And that is my presentation. So thank you very much, and very happy to be in the vanguard of promoting telehome care for a safer day for our seniors. Thank you.
Wonderful. Thank you so much, Jean and Mark. We're going to bring you both back up here. So we do have a couple of questions that have come in. First, I'd love to hear a little bit more about, if you could tell us a little bit more about the nature of the partnership and what makes that work. I mean, there's so many different people interested in connecting across the ecosystem. So many different companies have something to give. And we talk a lot about how there's too much happening in silos. So you guys have come together and you're partnering, and tell us a little bit about that and what makes that work.
Sure, I can jump in if you want, Jean, and then you can add in.
Thanks.
a few years back, one of our home care agency owners decided to, after growing his business to a multi-million-dollar operation, decided that he wanted better home care management software. He was tired of some of the industry products out there, and wanted something that was holistically built from the home care industry, from his perspective as a home care agency owner. So he began building a software platform and brought that to AHI Group. And so we partnered together. And then recently, his name is Greg, brought Gene to the picture. And so we now partnered with People Power, which has given us really exponential ability in the technology world. And Gene's up there in good old Silicon Valley with all the techies. But anyway, it's given us artificial intelligence capability with Gene's company and a number of other things that we're looking to do with this home care management software. And then, of course, Gene just talked about the product of in-home monitoring. And so that was another piece that we liked about what People Power had to offer. We thought that sits very well with helping seniors afford to stay home. Right. Ultimately, if I've got a caregiver coming in there for 15 to 20 hours a week, then who's taking care of that person outside of that? Is there a family member there? If there's no family member, then do they need some additional oversight in place? And would that be enough? Maybe it would be, right? Maybe they don't have to go to assisted living or a nursing home just yet. If we can get a caregiver in there for 15, 20 hours a week and get that paid for through a federal estate program, and then get a telehealth device like Gene was talking about in play, so a family can kind of stay on top of what's going on there and really communicate and see everything that's going on. So it just made sense to us to bring telehealth and connect that with the aid care services that we provide every day.
Okay, great. And Gene, from your perspective, what are you kind of getting out of the partnership, and what makes it work from your side?
Yes, well, and just to continue on with what Mark was saying, we actually acquired Greg's company, and Greg has now joined us as our senior vice president of healthcare, and it's fantastic because he brings on really so many years of direct experience in helping seniors with various chronic conditions. He worked at Kaiser. We're trying to work with Kaiser, and really what we're helping home care agencies do is modernize with a solution that is much lower cost, that is 24/7. And Mark, with his great wisdom, Mark and Christy, working together with so much knowledge in how to, for example, pay for services, and really knows everybody in that field. It's been a tremendous asset. People Power in general is a B2B company, and we work through service providers to bring technology to market. I'm a 4-time CEO, and one thing that I've learned is that in order to get your technology to millions of customers, actually the easiest way to do that is to work with companies who already have many customers who are trusted in that market, and get them to carry your technology into their customer base. So that's what we're doing with agencies as well as other service providers.
That's great. Now you guys are getting a lot of questions, some specific questions about cost of the solution and how you're different from competitors. And we'll make sure that all of these individual questions get back to you, so you can reach out to the individual attendees and answer their questions. But one thing I think is on the top of mind is a question that is probably on the top of mind for a lot of people listening to this is, and maybe this is for Mark, what are the devices that the VA benefit covers? So it's so vastly underutilized, as you mentioned, right? I think that there's probably a very low education in the space that this benefit exists. Also, clearly some usability concerns. If it's taking 1 to 10 years for applications to get approved, there's a reason probably it's not more popular. But can you tell us a little bit about what does that cover? I think people are interested in understanding that better.
It covers various things, and a lot of it really is how you present it to the VA, right? And these applications, not one is created the same as the other, frankly. Every person has a very unique situation financially, care-wise, and everything else. So our accredited team of agents handle all of that, but there's a variety of solutions that we can present and can get a VA to salute. It's just in how it's presented, how it's done. And so, for example, Gene's solution that he talked about was one that when it's explained in the right way and the right verbiage, the terms that they're looking for, right, and everything else, then it obviously gets saluted. So I can't really give any specific, it's got to have this, this, and this, and this, because it really just depends. I think some of those I could definitely take offline if there are questions about that. But yeah, clearly, how you present it matters, and how you're filing those applications matters too, because you will end up in the 1 to 10 year line where there's currently 900,000 VA benefit applications pending with the VA right now, filed at local VA offices. So needless to say, we don't go to local VA offices to file these applications. We go a different route because we don't want to wait that amount of time, obviously. But anyway, yeah, the short answer is there's a variety of things, and it just depends on it. So.
Okay. Well, thank you both so much for your time and for your insights. If you're able to stick around for the networking discussions, I'd expect lots of questions about your solutions and what you presented today. We're going to move on to the panel now. Thank you both. So now we're going to be joined by several industry leaders that we're going to bring up in just a minute to talk about what they're seeing in the market changes right now and in the past 6 months for the independent living space from their perspectives. So in just a minute, we'll bring them in and continue the discussion. Thanks. VP of Commercial Product with Best Buy Health, Laura Mitchell, the CEO of Grand Care Systems, and Kian Sanai, the CEO of Independa. So welcome to you all. I'm going to first ask you each to introduce yourselves and introduce your companies, just to give us a little context about where your perspectives are coming from today. We're going to go ahead and start with Chuck with Papa.
Thanks so much, and good morning or good afternoon to everyone on this cast. I'm proud to be a part of this, I think for the 5th or 6th year in a row. I'm Chuck Hector. I'm Chief Revenue Officer of a startup company called Papa Health. We're Miami, Florida based. I'm coming to you from my basement office in Deerfield, Illinois right now. I'm also joined on this cast by my head of sales, Nick Helfrich, who's listening intently. I have 30 years of experience in managed care, selling programs to health plans, employers, and health systems. I spent the last 10 years in the telemedicine space with MD Live. So again, very excited to be here. Papa Health is a Miami, Florida-based company that is situated in the social determinants of health category. By definition, we are a marketplace service, so we connect young, fun, energetic, youthful, college-enrolled students studying in the health sciences with members in need. And those members can be in Medicaid, Medicare. They can be, family members of an employee somewhere. They can be individuals who just need help with a family member who's 5 states away, and they need an extra set of eyes on the ground. We also do staff and labor augmentation. So we have partners like VRI and UniperCare, where we install devices in the home using these college students, and they go through a training regimen with the member, and then they interact in the future almost monthly with these members in the home to make sure they're using the devices properly and that the devices are recording the proper data and sharing it with the entity that's analyzing that data and providing additional services. So we are a gig worker facilitation app. So these are 1099 youthful workers that enroll in our program. We put them through 6 hours of paid training. We put them through neurodiversity education. We also train them in, of course, how to use the app, and we train them in how to interact with the members of all of our customers who are Medicare Advantage plans, Medicaid plans, staff augmentation, companies that install devices, etc. We currently do about 2,000 visits a day. Here, if you subscribe to the adage that a picture is worth 1,000 words, this slide is worth 3,000 words. Here, I figured rather than giving you a bunch of words and statements, we'll show you our workers. This is Jaden in the middle. He's actually in culinary school. He likes to go out and visit with members and prepare a meal. A lot of our Medicare Advantage members will get food in boxes that needs to be prepared. And they love the fact that Jaden will come out and prepare a meal and then clean the kitchen afterwards, and then take them food shopping or take them to a doctor appointment if necessary. On the left side is Julieta. Her mother is currently in the intensive care unit with COVID-19. And we're helping this Medicaid family cope and kind of coordinate logistically their activities while their mother is seriously ill, and to make sure they're stabilized. And on the right is Otis. And he was visited after nobody had wished him a happy birthday for almost a decade. He has no social interaction. He has no ability to use the internet technically, and was in need of basic services like food shopping. So we have 10,000 pals nationwide. We work with some of the largest health plans in the United States, and we just raised our Series B round of equity led by Comcast Ventures and the Bill and Melinda Gates Foundation. So I'm very excited to be here today and to talk to you about our experiences with COVID-19 and the sharp increase in depression we're seeing kind of across the board with our members served.
Thank you so much, Chuck. We're so pleased that you're here and able to join us, and looking forward to your insights. Next, let me introduce Sarah Jones. Sarah is the VP of Commercial Product for Best Buy Health. Hi, Sarah. Tell us a little bit about yourself and about Best Buy Health.
Yeah. Hi, Jennifer. Thanks so much for including me again in a Park Summit. It is always fun to participate in. I'm sad we're not doing our normal in-person networking, but here we are. I am, as Jennifer said, I'm Sarah Jones. I'm the VP of Commercial Product at Best Buy Health. Best Buy Health is part of Best Buy, which I'm sure you are familiar, is one of the largest consumer electronics retailers in the country. And we have over 1,000 stores and 20,000 Geek Squad agents, among many other resources that are serving people in their homes today. We'll talk a little bit about how that has changed in the COVID world. And Best Buy Health is a subsidiary of Best Buy, and we today serve over 1 million seniors through our Great Call brand, so Jitterbug cell phones, Lively mobile PERS devices, and we are working in our commercial space, which is what I'm a part of, to serve people in Medicare, Medicaid, senior living, and through a variety of different channels through our virtual care business. And we are really focused on seniors today and how to bring health into the home, which has converged for better or worse very acutely this year, as we've seen a lot of people spending time at home. So looking forward to sharing our experiences today. Thank you, Jennifer.
Thanks, Sarah. Next, we have Laura Mitchell, who's the CEO of Grand Care Systems. Hi, Laura. Thanks for joining us today. Tell us a little bit about yourself and about Grand Care.
Yeah, great. Thanks so much for having me. I'm Laura Mitchell. I'm the CEO of Grand Care Systems. Grand Care is a startup for the last 15 years. We're a little early to the game, perhaps. We are a socialization, touch-based platform that is designed to keep individuals independent, safe, healthy, and connected at home. So the centerpiece is, as you see on there, the big touch computer portal that serves as a source of information and reminders, cognitive assists, entertainment, video chat, connection to family. Optional telehealth and activity of daily living monitoring devices are placed around the home, and they can report wirelessly to the system and indicate if a potential red flag has occurred. So if something seems wrong, a family member or a paid caregiver can be alerted. For example, if someone had an increased blood pressure or excessive weight gain, or something that indicates that there may be a potential issue before that person, needs to have a further intervention. So we're really excited to be here. It's exciting that the telehealth and remote patient monitoring is at the forefront during these times. So thanks for having me.
Thank you as well, Laura. And finally, let's introduce Kian Sanai, the CEO of Independa. Kian, thanks again for joining us at a Parks Summit. Great to have you. Tell us a little bit about yourself and Independa.
Great. Good morning and good afternoon to the East Coast. It's great to be with everyone today and yet again at a Parks Summit. And these are always great events, and I'm sure they're going to be great virtual, but I do miss seeing everyone. I'm the founder and CEO of Independa. We are a remote engagement and care platform leveraging the person's TV. As you can see on the slide, everything HIPAA compliant at FDA Class 1. And we really serve three constituents, going B2B as well as B2B2C. One is the care recipient themselves. So the folks that we're talking about and previous speakers have been talking about, the elderly, but also really the socially isolated, the hardest to reach folks in our healthcare system and in our social circles. The organizations that look to care for these individuals leverage our technology to reach them when they're otherwise unreachable via computers or tablets. And certainly everyone can use their TV. In fact, I don't know if you can see me still on the screen, but a very small device goes behind the TV. And when I come back, I'll show it to you on the video. Last but not least is this circle of care. So yeah, this is a device, just goes HDMI in, HDMI out, and the camera gets connected on top of the TV. So very simple to install, very obviously simple to use. Nothing changes on the TV, no input change or channel change, etc. And last but not least is a circle of care around this individual, which could be professional and or informal. So friends, family, neighbors, etc. And all that combines to give you alerts and rules and connection to devices. Previous panelists and speakers have talked about it. So, catching something small before it becomes a major health challenge. So, of course, we all know COVID is a calamity, but also for us and for those probably in this session, it's really highlighted the value of reaching folks and allowing them to be engaged and also be monitored in a passive, dignified way. So it's great to be with you today and look forward to the discussion.
Great, thanks, Kian. And thank you all for your introductions and for being here for this discussion. So let's start with the seniors and caregivers that you serve. You each have a unique view into this market because they are your customers. So can you tell us a little bit about, from your kind of boots on the ground and your interactions with the customers you serve, what are they struggling with most right now? And how have their needs changed over the past 6 months or so? And Kian, why don't we start with you?
Sure. So when COVID hit, clearly the value props that we all talk about became much more highlighted, and everyone became that much more aware, and the challenges became accentuated. So in particular, let's say senior living as an example. I felt like there was an acceleration, like everyone had pushed the pedal down to accelerate forward with these solutions, but at the same time, the practical implication was the brakes were put on as well, because no one could be visited in any way. You couldn't install systems. So the needs haven't changed, but what has changed is really highlighted the challenges as well as the need for the systems. And we now all hear about social determinants of health as a big part of healthcare. One of the presentations I gave actually at a Parks conference a couple of years back was all about the consumerization of health versus the medicalization of healthcare. And I think COVID has really accelerated that. Healthcare is coming to the consumer, and particularly in our case, the older adult is that much more challenged today. You have friends and family who love you and can't visit you, even though they may be down the street. Now with kids going back to school even, it's that much worse. So social isolation is a major challenge still. I think the country looked at social isolation and implemented physical isolation, which we all know there was an epidemic of depression anyway in this age group, and that's only accelerated forward. So what we do is we separate the two and say you can be socially engaged and still physically isolated and protected if you have to be. And again, we think the TV is a major opportunity there. Also, let me just mention one other thing, the payment systems. That's a huge difference for all of us, where now because of CMS changes and HIPAA changes and FTC guideline changes through COVID, a doctor can come in or a pharmacist can come in and get paid. And again, in our case, could be a large screen that you're chatting with over the TV. So we think that's another game changer, and that cat's out of the bag. And I don't think that's going to go back. So I think that should be great for everyone.
Yeah, I think that's really interesting. We should loop back around on that, especially when it gets to new use cases. I think that there were a lot of people in this market who were stepping into remote patient monitoring a little bit, and now probably we should expect for everybody to be going that way. There's a lot of assets that you guys have to bring to bear. Let's hear from Laura as well. Laura, in the customers that you're working with right now, how have things changed for them over the past 6 months?
Well, I agree with pretty much everything Kian said, and it's exciting to be on another panel with Kian because we've been on panels for about the last 10 years together, and always sort of fighting the good fight about the fact that seniors deserve the chance to be connected. And just because you don't have internet or just because you don't have a smartphone doesn't mean that you don't need that social connection. And so I think that COVID has brought that to the forefront. In the future, there will be no more, on the news, we see all these photos of seniors looking through windows, talking to their family members. And I think that is just an indication of where we are right now versus where we need to be. And internet connection needs to be ubiquitous. It needs to be a general utility that is provided to all. And so our big takeaway with COVID is the fact that isolation is real, it exists. So even though we're taking care of seniors from a physical, a mobility perspective, we need to also take care of them from an emotional and social engagement perspective. So suddenly we're realizing that video chat is necessary, even though in person is ideal. That's not always going to work out. So our number one takeaway is the socialization and engagement. The number two takeaway is that there is now the fear of congregation. So whether that is going to a public place, whether that is going to church, or whether that is going to a doctor's office, that is a real fear. And now it needs to be that we take the future and bring us back to the past. So we take our future technologies and we bring it back to where the doctors used to come and visit us in our homes. It's obviously much safer obviously when someone has a virus or a disease, we don't want them going into a public place. So it is a good thing to have the healthcare delivered at point of care. And that is another thing that telehealth monitoring, HIPAA compliant video chat, self-disease management, particularly with telehealth, being able to empower the patient to take care of themselves is a critical piece that I think COVID, unfortunately, as all of the negatives of COVID, I think that it has brought some silver linings.
Yeah, I think what you talked about a lot, we did talk about yesterday too, about this shift in mindset from care having to be facility-centric to home-centric. And when we shift our mindset to that care delivery can be home-centric, what does that mean? And a lot of new ways of thinking operationally and what can be done comes up from that. So that's
great. Lots of opportunities.
Yeah, absolutely. So Sarah, I'd love to pick up on something that you mentioned or you hinted at, and then Keon mentioned as well, is that one of the impacts is the inability maybe or limitations on the ability to install systems and to go into people's homes. Is that something that you're seeing with Geek Squad, and what else are you seeing in your interaction with your customers?
Yeah. Laura, Keon, and I have learned a lot of the same lessons this year about isolation, which was a lot of my notes, but I will touch based on what you said and probably build on that a little bit. I think there's two other things that are worth noting in terms of people are struggling. So getting into people's homes, we heard earlier, and certainly we have solutions that are a person coming into your home to install something, and the game has changed on that. And so we have shifted some of our operations, especially in the health space where we're dealing with seniors who are inherently more fragile, to be virtual installations where someone is walking you through that, or they schedule with a caregiver who might be able to be there. But there are ways that we can still deliver that high touch model from afar. It's certainly more challenging. And I think what Laura said about, hey, being in person is best. In this case, it absolutely is. One of the other things that I think people are struggling with is we accelerated digital health so much this year. And so providers are seeing this as a struggle too, but the seniors especially now are forced to deal with trying to talk to their doctor via a video chat. And so how are we helping seniors in particular, and providers and the entire stakeholder system, figure out how to download the app, what app they use for their general practitioner compared to their specialists? How do we make sure that those experiences are reasonable for them? And I think right now we're doing sort of everything we can to make that come together because we have to. And looking ahead, it'll be important to make those experiences better. But just managing I need to download this app so that I can interact with my doctor, or click on this link and log into my email. Those are real tactical challenges that we have seen a lot of people calling into our call centers to say, hey, I'm not sure how to download this app, but my doctor said I need it to be able to talk to them about my XYZ condition. And the other piece that I think is worth noting, and this tech challenge is compounded for this group too, is caregiving. So both professional and family caregivers, the game really changed for them. So all of that virtual health stuff starts to come to bear on the caregivers who have to learn new tech. But I was on a panel recently for HIMSS where a nurse was talking about how she used to go in every single day to see patients all day long, and how that has changed so dramatically for them. And they've had to really focus on new things. And Laura, you talked about, the pictures of seniors and caregivers touching through their windows. And so it's been a very interesting challenge to figure out, how do I continue caregiving without the ways that I've done it all along, which is dropping off groceries and going in and making sure that this environment is safe for my mom.
Yeah. Let me follow up a little bit on the support services you were talking about, that, whether it sounds like whether or not it's actually your system or your solution that they're having trouble with, they're calling you for help with the apps and everything that they're working with. This is something we hear a lot in the internet service provider community, that doesn't matter if it's that your computer's broken, they're calling Verizon and looking for where it is in the home network. And so I think that's really relevant to this conversation too. So, do you feel like Best Buy and Geek Squad, or maybe the Great Call angle, that you guys are a great place to play that role, to answer all these questions, or do you guide them to the right place to answer?
Yeah. So Best Buy as a core entity has a membership service called Total Tech Support. And we launched it 2 years ago, and it already has 2 million members. 66% of those people are over 60. So we know this is filling a huge senior need. And the way that works is any technology that you buy, Best Buy will help you support through that membership. So whether you bought it at Best Buy or not. So that is a great landing place for, hey, my printer won't work. I don't know how to connect my iPad. I have a virus and I don't know what to do. We see tons of that input and tons of growth in that space. And in the health space, one of the things we're doing is, how do we make Total Tech Support more health oriented? How do we say we can help you connect your blood pressure cuff? How do we let a Medicare plan offer this as a supplemental benefit, as an example, so that they can then say, hey, we're expecting our members to be connected, but we can help create that environment in their home where they have the support. So it's absolutely a place that we are playing today and want to get more health oriented as we go.
Yeah, that's really interesting. I know that we've heard concerns from care providers who are interested in, using remote patient monitoring, let's say, to the home, and really concerned about, they've seen what patient compliance looks like to their discharge instructions or to their medication plan, right? And so then you bring devices into it, and there's a very high concern about usability.
Yeah, it's a huge focus of our virtual care business, because we know, to your point, shipping a box of devices, a good model to encourage success and engagement. So it's a huge area of focus for us.
Well, I'm going to turn to Chuck in just a minute, but I want to remind people that we have polling questions to the side. The first polling question is about the most impactful change in the senior technology market during COVID-19. So I'll read out the results in just a minute. So if you want to go ahead and log your response to that question, please go ahead and do so now. But Chuck, so in your opening comments, actually, you spoke to some really interesting ways that I think you call them Papa Pals, right? The essentially gig workers, right? Who are the boots on the ground, speaking to that social element with having a happy birthday cake, right? And visit and cooking and taking care of family members, really interesting. So I imagine operationally, though, there's been impacts on how you engage with people and considerations about, whether or not your pals are at risk for spreading infection, right? Can you talk to us a little bit about how it's impacted operations and how you serve people?
Yeah, definitely. So COVID, I think, has presented challenges and opportunities for all of us. The way it affected us, in March, we had, we work with about 40 health plans, and 30 of them called and said, hey, we're following state orders and we're suspending all in-home services, not only you guys, but, in-home medical assessments and nurses and home care, everything, just stopping it. And so, we said, look, we're already dealing with lonely and isolated members, and many of them are calling us. And for many of them, we're their only friend. We're their only outside contact to the world. We're, in many ways, keeping them moving forward. And now, the world is telling them to isolate further. We quickly launched Assistance from a Distance, which is our secure streaming video connectivity portal. We also launched a telephonic version of that. Because we operate on a single instance of technology with our 10,000 pals, we're able to do broad sweeping training quickly. we're able to verify that the trainings have been understood and completed, and that there's compliance with the training, and that the Papa Pal network understands the impact of the training and how to apply the training in their everyday work. We were dealing with these members, and we were going into the home and preparing meals and driving them places, and then all of a sudden we had new health plans calling us saying, hey, if I give you 10,000 of my highest risk members, can you call and do like a welfare check? And of course the answer was yes. Talk for 30 minutes with a member and say, do you have enough food? How are your medications? Are you in pain? Is anything scaring you? Don't watch the news every day, regardless of what your political affiliation, it will further depress you. We would do a social determinants of health quick survey. We would do a PHQ-9 to find out kind of their level of mental discomfort. And we have seen a massive and continuously growing, kind of a sub phenomenon of depression growing within this cohort. But here's the reality. Assistance from a distance has worked incredibly well and continues to dominate our connection points today. But we have a lot of members for plans like Aetna and Humana that we continue to do face-to-face services for. These are people who have kidney dialysis 3 times a week, or they're getting cancer treatment, or some other life-saving treatment that simply virtual will not help them. So picking up medications, doing grocery shopping and touchless door drop, these are all essential components of kind of the wraparound services and how we address and help impact this particular cohort. These members need to understand clean sterilization techniques. Believe it or not, they're not super scared of the Papa Pals because we have them testing on some frequency. We also have a coordinated relationship with the CDC, and we push best guidance on how to manage your working relationship with the member vis-a-vis the CDC guidance through the app. So using technology to communicate all these changes and all these business operational modifications, but we're still the human capital company. We're the kneecap to kneecap, member to member company, and all of our members and plans are looking forward to the day when we can declare victory and reopen face-to-face services. But for about half of them, face-to-face hasn't stopped, and because we're employing these safe protocols and clean sterilization techniques, we haven't had one documented instance of transference from a member to a pal or a pal to a member.
Yeah, it's quite an accomplishment, and so much change in the past 6 months that you've had to do operationally.
For sure.
Well, let me take a look at the polling results. So I asked, what is the most impactful change in the senior technology market due to COVID-19? And by far and away, the top answer is an openness to new approaches to staying well at home, followed up by a little bit of interest in, the fact that COVID-19 infection clusters in senior living facilities may be driving a little bit, again, more interest in staying at home, and then growth in consumer awareness of solutions. But it's really more this openness to try new things that's top of mind for everybody answering this poll. So thanks for participating. So let me go back to Laura. When we think about a new mindset, right, that a new openness to doing things new ways, trying new things, are you seeing new use cases for your systems, or maybe parts of your platform that were maybe lower priority or lower usage and now have jumped? How have things changed from a use case perspective?
Well, it really hasn't as much changed from a use case as much as it has verified that the social engagement is critically important. In the past, folks were much more interested in the remote patient monitoring part and saying that, we just need to monitor these folks. We need to know what their blood pressure is. We need to know if they moved around. But it wasn't such a critical focus on the patient engagement. So in other words, the socialization, the family connection. Some of the changes we've also seen is the fact that we're having new customers come to us with a need, and it wasn't exactly where we thought it would be. One particular component is in the disability population. That's been an interesting one for us, and it's very exciting because the disability population, although we had built GrandCare from the ground up with the senior population in mind, but the disability population came to us, and it's been a different mantra as far as the disabled population wants to have the technology because they're using it to be independent for the first time. And not necessarily for the first time, but more independent than they had been previously. Whereas with the senior population, it's a lot of times losing independence, which is a much more difficult concept to grasp, and obviously is a difficult thing in life for most of these folks. Something else that's been interesting has been the payers coming forward, as well as the healthcare systems, but it's been mostly the payers coming forward saying, we now are unable to complete our in-home assessments. We have all of these Medicare Advantage clients that haven't received in-home care. They don't want to have it. They can't have it. So they're being forced to look into telehealth and video chat options in order to service the population that they need to service.
Mm-hmm. No, I did mention when I was talking to Keon earlier, and he brought up the changes in reimbursement, of course, for remote patient monitoring. And I kind of hinted at expectation that we'll see more, robust services in these areas. Can you talk to that at all from Grand Care's perspective? Are you making any changes to your platform, your strategy, or anything you can talk to on remote patient monitoring?
So yeah, I mean, we're just doing some more focused around assessments. So a lot of the payers and healthcare systems not only want to know how the patient is doing, but they want to know about more objective assessments of how are they feeling? What are they happy? Are they feeling isolated? Are they able to take care of themselves? So we're also improving some of our patient instructions on there so that if they are leaving the hospital, they've got adequate discharge instructions. They've got adequate instructions on how to use their new glucometer, things like that. So it's more about empowering the patient, and I'm just using the term patient here just across the board, but it's empowering the individual to help take care of themselves. And we believe that technology can help do that.
Yeah, absolutely. Well, so Keon, let me go back to you. Can you talk about if you're seeing any new maybe use cases or applications of your solution kind of rise to the top here in the last 6 months, or talk to maybe any new changes or features that you might be making to your solution that maybe serves needs a little differently?
Sure. Yeah. The biggest thing is really, I read somewhere last year, and it was before COVID, and it was an article at a medical journal around how the TV may be the digital health platform that we've been all waiting for. So it was kind of validating that point. But with us, the biggest change is really understanding that, especially with less people who are able to visit and less mobility, it used to be if the car keys were taken away or if you had some challenges to go places on your own because of some health conditions, then that was really a bad thing. With COVID, everyone's in that boat under a certain umbrella of maybe seniors or older adults or high risk individuals. So for us, the biggest difference is the payers and even pharmacies looking to go into folks' homes and not necessarily wait for them to come out to them. Sarah gave an example of a video chat session with the doctor and how that older adult has challenges to make that happen. I have to say, I had a problem getting on an Epic, video chat session with the doctor myself. There were like 3 or 4 different versions of the app on the App Store, and there was no documentation on which one was mine. And you had to go with the blue one with the little, digital dots instead of the solid blue one and not the red one. And they all had a little plus sign. And that's me versus if I'm, let's say, 80 or 90 and I can't go in to see someone, it becomes vital. And my daughter can't take me in anymore. And so who's helping me? So what Best Buy is doing and what we're doing is we're saying, oh, and by the way, if and it wasn't even on my browser, they still don't have something on the browser. So you had to be on a mobile app. So if you can then leverage a TV in that engagement, that's a huge advantage. Now, we're not quite there because that doctor has to be invited very easily, which they can with our app or with others. And I think that's where the healthcare system is going, is to make it empowered from the older adult. And I think COVID is really pushing that, to say the older adult can say, you're going to get an email, or the daughter sends an email, and now you can actually talk to grandma on her TV, and you can get paid for that. So I think that's a game changer. And as I mentioned, the providers as well as pharmacies are net new B2B opportunities for us. And lastly, for us is the consumer market itself. I mean, we've always been able to sell into the consumer market, but we never focused on it. And, one of the big changes is like we launched a national TV ad for going into the consumer market because of COVID, because there's plenty of people that don't have necessarily home care and don't have, senior living affiliations, but need the services right away.
Yeah, it's interesting. Well, so you being in the B2B space for as long as you have, let me ask you a little bit about the maybe demand for use of your solution right now in skilled senior living facilities, right? Which we know have been impacted and have had particularly strict policies for visitors. And so a lot of isolation from family members there. I'm also hearing about some hospitals that are trying to make better use of the TVs in their patient rooms, especially for COVID patients, right? To be able to, speak to family, loved ones, regardless of age, right? It's just that, hey, we've got this asset of a TV in the patient room. Can we be using that for telehealth and not have to buy a cart or some other big solution? Are you seeing that yourselves with Independa?
We are. So that's a good point. We do have a patient education system that's entirely separate. We don't market it under our brand, and we OEM it to others. So there's more demand for that, and people can brand it as theirs and go into hospitals. So hospitals definitely are looking at that. And that was happening anyway because of readmission penalties and all of that. On the other side, the senior living area is interesting because I think the brake pedal is winning right now versus the gas pedal. And what COVID has done is, as we all know initially, and I think, I don't know who mentioned this, but 40% of all deaths right now are coming out of nursing homes, which is a ridiculous number. And what happened as a result is everything got shut down. And the initial issue was, okay, how do I have PPE for my staff? So that was the first vital step. Forget about technology. I need to protect my staff. Second was, okay, no one can come in. And here you are paying thousands of dollars a month to not be able to go have a meal with your neighbor, to not be able to have visits, and not be able to do any activities. So what's happened there is, and this is not me talking, this is the industry, but you have a drop in occupancy rates and you have less people coming in. So a lot of the emphasis that you've brought up and others have brought up today around home being the place is really also being driven by that. Who's going to go pay many thousands of dollars to just be isolated in a room? And then bringing it to our industry, Zoom did a great job with staff members walking around with tablets outside of people's door frames and wearing hazmat suits so that family members can have a chat with these individuals. And so that's really not sustainable. That's where we and others can come in and change that, create efficiencies and engagement in a scalable way versus what's being done today is people running around with tablets and Zoom.
Yeah. Okay. Great. Well, let's bring in our final polling question for this session. So give the cue to the attendees here. If you haven't already weighed in, we have a second polling question related to what's standing in the way of further market growth or additional challenges that need to be overcome in the senior assistive technology market. So I'll give you guys another minute or so to get your answers in there before we talk about them. Maybe I could come back to, Chuck here. It sounds like you guys have done a lot to respond to the challenges, that your organization faces right now. What else do you see are kind of the major barriers or pain points that we need to kind of get past as an industry? What are the next steps that need to be taken?
For us, it's really just a proposition of expansion and getting to reach more members. Today we cover, about 40 health plans, but there's so many Medicare and Medicaid beneficiaries, and there's people on original Medicare who need help too. So I think, finding a pathway to get into and to service original Medicare beneficiaries for us would really be the golden ring. We don't, beyond COVID and the protections around transmitting the virus, there really are no obstacles. We have, contact centers that can efficiently reach out to members and enroll them in this program. Most of the time, they can't believe the program is real. They think it might be a scam. They can't believe that a health plan would pay for a Papa Pal to come into their home and basically be a helper for 10 hours a month. So for us, it's really just an expansion proposition. When we get in to the home, it's a very curated process that we go through with the member. There's, on the one hand, the things that they want to do, such as pick up the house or walk a dog or go to the park or see a friend on the other side of town or go shopping. And then there's the things that the risk-bearing entity or the plan sponsor would want us to do. And that typically involves care gap notifications and the coordination of how this individual interacts with their own health status and the type of prevention that they should be engaging in. Once we can foundationally create that relationship with the member, we in effect become an extension of the family. And some of these members have no immediate family, or they have a small immediate family that lives 10 states away or thousands of miles away. So for us, it's really, kind of an expansion proposition. It's gaining agreement with, some of the larger industry stakeholders like CMS, and CMS already approves PAPA through Medicare Advantage as a filed supplemental benefit, but getting into original Medicare, getting into employers, spreading the word that, in every community and everywhere in the United States, there's a young, fun, vetted, background checked, young academic who's willing to come in and be paid and to help these members with whatever's challenging them.
Yeah. So one thing I'd love to just hear a little bit about is, one of the major issues we see is reaching seniors who are not connected. We're talking about connected health, right? Connected technologies. But for many seniors, they don't have reliable connectivity, or they might not have, broadband internet at all. May have a cell phone, not a smartphone, right? I know that one of the examples that you gave earlier was of the gentleman you mentioned who was really not tech literate, really had no connectivity. Can you talk us through how do people like that access your services? How are you reaching?
Yeah, no, for sure. I mean, I think most of us know on this panel that 11,000 people a day have a 65th birthday in the United States. So aging into Medicare is, there's waves of them every day, and every decade it gets larger and larger. Medicare Advantage is a huge space, and it's going to be even more significant by 2050. Today, our services are largely predicated on the use of the telephone, and most of the members has a telephone. As we expand our service offerings and empower our partners, we'll be able to use Papa Pals to go in and do things like ACA risk adjustment, going into the home and empowering a device or setting up an existing device in the home to permit a streaming video visit. Nick, who's on the phone today, and I just sold a health plan in Wisconsin that starts in January. They have had us buy 10,000 iPads, pre-install their app and the Papa app. And the Papa Pals are going to be hand delivering these devices throughout Q1 all across Wisconsin. And this is a plan paid device with a plan paid Wi-Fi package. And this is the plan's forward-thinking way of saying, we're going to give you the device. It's expensive, and we're going to trust that you're going to use it because we need to connect with you and know more about you than we know today. And this is only possible when you have a local, inexpensive, trusted resource that can go out and provide this level of tech support. Home care, traditional home care and private duty is very expensive. Those are typically run by franchise organizations that want somebody out there 3 or 4 days a week. You can use a Papa Pal 1 day a month. And so this is a very flexible, scalable proposition. But you don't have to have Wi-Fi necessarily to be able to access our services. But in our social determinants of health examination that we do in the home or over the phone, we're looking for those capabilities, and we're documenting whether they do or do not have access to Wi-Fi and broadband. And then we can solution with our partners around that, whether it's a Medicare Advantage plan or whether it's a large company that we're doing workforce augmentation for.
Okay, great. Well, let's look at the results of the poll. So most of you feel that consumer awareness of solutions really is the largest barrier that remains, and then following that, seniors' inability to set up or use solutions. So kind of going back to that tech support problem that we talked a little bit about with both Chuck and Sarah. Sarah, maybe if I could come back to you, and then we do have some other questions that we'll take and discuss as a group. If there are other questions, you can put those in the questions tab. So Sarah, maybe when we talk about just consumer education and awareness of what's out there, can you share anything about what messaging works, maybe what marketing channels, are most effective? And, to talk about a little bit about something we touched on earlier, the user and the buyer, if it is a direct consumer solution, maybe different, right? If you're talking to a family caregiver, you're talking to the senior themselves, right? So that complicates that message. Can you talk at all to, best practices that you've learned?
Yeah, I would say it's very nuanced. For all the reasons you mentioned, right? Is the caregiver buying it for the senior? Is the senior buying it? And now we want to share senior data with a caregiver. And then when you add in my Medicare plan bought this, and does my doctor know about it? There are a ton of complicating factors to think about in that experience. So in terms of best practices, there's some very tactical ones. I would say a very tactical one in the senior space is if you want to have an app that's great, we can get over that hump. You touched on, do you have a smartphone or not? Like we have to cross that chasm first. But if you have a smartphone and you want to deliver an app, great. But what happens when you have a question? And lots of startups today, for very reasonable reasons, have the only support is, a bot support in the app and a Q&A in the app. And when something goes wrong, we know from research that when something goes wrong, it makes a senior feel less than, lose confidence, not interested in continuing to use that. So having a very good support flow on the phone, via email, videos, those are all things that can really help create that experience. And then in terms of messaging, it's important to think about let's just take the senior, their ecosystem is. They have perhaps a Medicare or a Medicaid case manager who's involved in their decision-making, their daughter, let's say, their physician, them, their spouse. All of those people are key influencers. I'll give you an example of something we did wrong. We have a sensor offer that we offered through the plan. And people would go to their doctor with all this material and say, I got these new sensors. And the doctor would say, what is this? I think it's a scam. And so because we didn't have that doctor involved in the conversation, it was very complicated to unwind that and say, it's not a scam. It's being paid for by your plan. So we didn't include your doctor. We didn't know who your doctor was. And so that was a big lesson to think about. How do we involve all of these stakeholders to the best possible way? It's not always obvious or possible to engage all of them, but I think that's a very important piece to think about in bringing these new solutions to life and making them all aware, of the goals and of the value so that senior can really continue on their engagement journey.
Well, we did get a question for you, Sarah, but it's also relevant, to the rest of the group too. But I'm wondering if you're seeing shifting in interest from the more traditional PERS type solution over to the sensor-based picking up activities of daily living. And of course, I say traditional PERS, but Great Call was also smartphone based, right? So you guys were unique, in the beginning from the traditional PERS industry. So there's a lot of questions here really related to form factor. And I talked also about kind of the wearables element. There's a lot of different options now. Can you talk at all about maybe shift in the portfolio and interest in different types of solutions?
Yeah, a funny nuance is actually during COVID, a lot of people said, I do want to have a PERS. I want something that's really easy and reliable.
Yeah.
So that's sort of counterintuitive to the rest of what we're working on, which is Chuck mentioned how many people are turning 65 every day, and most of them have a smartphone as they're coming into age 65, right? And they will continue to be a more digital native than an 85-year-old today. So from our perspective, we're thinking about things like, how do you enable that emergency response and non-emergency social response through an app? How do you do it through voice technology? How do you do it through sensors? We had the presentation earlier that touches on a lot of the work we've been doing for years as well. And I think those are all things when you think about the user experience really deeply and what that person's journey is and their needs that come to life. The challenge, truthfully, is making sure you're picking the right voice technology and the right wearable, and how do you create an ecosystem where everyone can show up with what they have and be able to get that same service expectation. I think that's a really important piece, and we are certainly seeing a lot of growth in that area.
Yeah, absolutely. I think it was actually Keon, were you talking, or maybe it was Jean that was talking about all of the different platforms that they, plug into. But, Keon, do you want to talk at all about, changing form factors that you're seeing, or if there's a new interest in working with maybe third-party devices? If there's been any shift in demand for other types of form factors.
Sure. So for us, we're a software platform. We're a platform as a service in the cloud. So we're totally agnostic around that. And we've been talking about that for years now, where we're not a remote patient monitoring system, but we integrate with the devices. Or we're not an IoT system, but we integrate with those devices. Or same thing with activity sensors. So for us, it's about unifying all those sensors and devices and standards and companies and products into one area where you can have central reporting, central thresholds, central alerts, central rules to catch those little things before they become big problems. So we haven't seen a shift in that on our side, other than, for instance, remote patient monitoring has taken off much, much more now than before. And so that drives the question, if I want to change a particular device, what does that mean to my integration options? What does that mean to my support functions? What does that mean to my data, pathways and so forth? And that's a good thing for us from a sort of a platform integration standpoint, but it's not anything that we've done different.
Okay, great. Well, so the next question that came in was really related to solutions that maybe are more proactive and detect activity and wellness monitoring versus that can detect decline in health, versus something so that's more proactive versus something that's more reactive, right? And just detecting those falls. Laura, maybe could you speak at all to kind of this divergence? We know that falls is the trigger often for looking into a solution. We know that traditionally the senior assistive technologies market has been very reactive, but we've got this kind of health and wellness monitoring that is meant to be more proactive. Are you seeing anything there that you can share?
Yeah, so GrandCare was designed to be predictive, proactive, and preventative versus a crisis management. So we are obviously different than the, help I fall and I can't get up model. We like to detect an emergency before it becomes an emergency. So in other words, there are a lot of indicators that could determine that someone wasn't doing well. First and foremost, it's medication management. So is the person taking the medication at the right time? And that's a real simple one to get right or to get wrong. And so our touchscreen can prompt them when it's time to take the medication. They can acknowledge whether they've taken it or they can refuse it. That's a real simple one. And then obviously the activity of daily living monitoring can be another indication of this person didn't get out of bed in the morning, they didn't access the fridge at mealtime. Very simple ways that you can know that something might be wrong. And of course, the telehealth monitoring, that's a little bit more aggressive as far as if patient gains 5 pounds in 2 days, if especially during COVID times. If a temperature is detected of above 100.1, if the pulse oximetry is detected below 92%. Now, the interesting part about what we think at GrandCare is that there needs to be a baseline. It's a problematic when we don't know what the person is like when they're healthy. They come into the hospital, they present with all these symptoms, they're at 92% pulse ox or 90%. Well, what is their normal baseline? Let's say that it's someone with COPD and their normal baseline is 94. That's very different if they're presenting at 91 than if their baseline is 97. So those types of things are important to know, and that's why it's critical to get these technologies in place before the patient gets sick, before they are having problems, so that we can detect this person's normal temperature is 96 degrees. which means a 99-degree temperature is more critical than if someone's normal temp is 98.6. So I think that is what we're learning. I also just want to say one quick thing about what Sarah was talking about before with call centers and the fact that, bots and things like that. We've identified that as a critical need to find a call center that was dedicated towards the senior population. You can't just have any call center helping to support these types of technologies, which is during COVID, we have partnered with MyGate, which has been in the industry for senior-friendly computing for 20 years. We've known them forever, and we have partnered with them to provide full fulfillment and customer installation support and customer support during these times to really make sure that the out-of-box experience and along the entire continuum is a positive experience. Great.
Well, I know that for a lot of the providers and health systems that are attending, one question that's come up from them is about, who can they rely upon to be kind of the connection into the home and that support agent in the home. So I think there's going to be a lot of interesting conversations between the folks on the panel here and these types of companies, as well as back into the care provider space. With that, I want to thank you all very much for the discussion. It was wonderful. We are going to break into our networking discussions now. So if you look in the chat tab of the right-hand panel, our team will be posting, if they haven't already, posting links to, I'm getting a thumbs up, meaning they have, posting links to the networking discussion breakout rooms. And so that'll take you actually into Zoom. Where some parks analysts and parks team will be there to host discussions. Please come on in, introduce yourselves, and we'll get some nice conversations going. And then we are back here at 12:30. At 12:30 to kick off our afternoon. And that will start with a discussion on home-centric care, activating this ecosystem through partnerships. So you're going to want to come back in through the Swap Card platform. We'll see you in about a half hour. Thank you.